Health Services Zoom meeting today, and I'll just start off with, I think, a very pertinent karakia. Whakataka te hau ki te uru, whakataka te hau ki te tonga, kia mā kina ki uta, kia mā taratara ki tai, ehi aki ana te atakura, he tio, he huka, he huhu, ti he Māori ora. And I'm going to translate that today because I think it's very pertinent. Get ready for the westerly and be prepared for the southerly. It will be icy cold inland and icy cold on the shore. May the dawn rise red-tipped on ice, on snow, on frost. And after the hail this morning, it feels very much that's the right thing to say. So welcome, everybody. First, I'll advise that we've already started recording this hui. Presentations will be run in order of agenda, except for one, which I'll talk about in a moment. Only one person from each organisation presents, though you're very welcome to be on the Zoom, more than one of you. Presentations will be timed, but presenters will be muted. And sometimes people get annoyed about that, but we've got a record number of NGOs today, and we won't be able to fit everybody in if some people take a little bit longer. So we apologise for that in advance. If everybody puts their name, organisation on the screen, a lot of you have done this before, so you'll be very aware of the drill. That helps everybody else recognise you. And presenters can put their contact details in the chat box for anyone who wants to connect or contact them or has questions following the meeting. And I'd also just ask all the health professionals and community RSVPs just to raise their virtual hands so we can say kia ora to you. We have a few people here, which is great. So welcome everybody. And also just when I start the NGO presentations, we'll just ask each section to raise their hands first, then you come to the top of my list so I can see you easily. So we are changing the general updates just to be really accommodating of our wonderful Waitakere site manager, Paula Seymour. She's got a later meeting and it would have meant she couldn't come, and we would really like to hear from her. So welcome, Paula. And Paula is General Manager, Child, Women and Family Division and Site Manager for Waitakere Hospital for Te Whatu Ora Health New Zealand. So Paula, we're going to give you the floor so you can do your update and then get away to your meeting. Welcome.
Kia ora everyone, and thank you very much, Linda, for that very warm welcome. It's always wonderful to come to these meetings and see the connection that happens, and particularly for our staff, the community connections. And great to have it recorded so that anyone can see it when it's can be quite a busy time on the wards. So I just wanted to update you on what's happening with the hospital. There's been a lot of design and plans happening in the background, and we're aiming for by the end of this year seeing some work being done. So the biggest thing, and the thing that's had much contribution from the community, is the new 30-bedded medical ward and ICU that is going on site at Waitakere Hospital. The design's being completed now, and they're just negotiating with the contractor. So everything going well. We expect the sod to turn in September and it to start, and us to see some really fantastic construction there. So it will take 3 years to complete. I think we already need the 30-bedded medical ward now. We're really feeling winter coming, but that is really exciting news for Waitakere. We also, and I know I've talked about this before, but the front of house, it's gone out for pricing. So once that's been complete, we'll start to see some of the some changes at the front of house, the main reception and entrance area. And there's some work we do. We've had a designated space for NGOs to come, so we just need to work out how we can use that to best and be using Waitakere HealthLink as a facilitator to work that out. So that's the other exciting news. We have the primary birthing unit, many of you will know, has been on the agenda for a number of years. I think Tracy looked back and it was 2015 that we started talking about this. A lot of work has been done on the design. The business case has gone through Te Whatu Ora and has been approved by the Te Whatu Ora board. It's now sitting with the ministries, and as with all capital investment, there's been some questions around funding source. Previously, we were looking at social investment funding. That's now gone to the to Te Whatu Ora. With those questions, we've just done a paper on how that's going to work. We know the community is very supportive of this, and we expect it to go to the Minister of Health and the Minister of Finance next week. So we can't confirm that yet. We're really hopeful that it will be going ahead, because it is something that's needed for particularly for our women and families out west. So those are the main things that have happened within Waitakere Hospital and the facilities changes we're seeing. We've obviously now a year into Te Whatu Ora with some really good changes and some good regional working that we've seen along the way. So that pretty much covers my update of what's happening at Waitakere. Very happy to have questions or comments.
Thank you very much, Paula. I must say, I don't know if any other communities get this great relationship where we're getting updated as a community. It's very much appreciated, and we really appreciate your trust in us as an organisation and all the NGOs that you can share these things with us, and you know, it does make a difference to know what's happening. I think in terms of questions, if just because of time, if that's okay, if anyone wants to just put a question in the chat, and what we can do is Tracy can put it together and send those questions to Paula. It might just be easier, because I think we could go down a long rabbit hole on this, unless there's anything urgent, but I think that might be the best way to deal with it. But thank you so much, Paula. I'll talk a little bit later about what the Waitakere HealthLink board think we should do to help urge a positive decision on the birthing unit, and when we can involve NGOs in the community. But reassure you, Paula, we're going to be very seamly about it and professional and positive, so that we don't muck up any opportunity for Waitakere. So we'll talk about that later. So thank you so much, and we'll let you go if you need to go, and we'll see you at our next HealthLink meeting.
And lovely to see you all. I'll be very excited to see people in person at the AGM.
Thank you. Great. Bye.
Thank you.
Okay, everybody, what we're going to do now is move on to our NGO presenters forum. So what I'd like to do is, if the long-term conditions group can pop their virtual hands up, that would be great. So that's Amitabha, Anxiety New Zealand, Asthma, Disability Connect, Epilepsy New Zealand, Hospice West Auckland, Independent Living Charitable Trust, MS Auckland, Muscular Dystrophy Northern, Neuroconnection Foundation, Stroke Foundation, Wilson Home, and I think we've had an apology from Your Way, Kia Roha. All right, so as we said, 1 minute 30, so we'll start with Claire Barton from Amitabha. Welcome. We've got Claire here. Yep. Go, Claire. You need to put your microphone on.
Hello, everyone. Morena. I'm sorry, I'm not Stephen. I am Claire. Oh. Sorry about that. He used my computer. I didn't realise. I am a volunteer coordinator at Amitabha Hospice Service. We're a small team of 5 based in Avondale and coordinate a free support service that is provided to patients in their own homes. Our service is delivered by wonderful volunteers from the community who want to do something helpful and enriching through offering regular ongoing psychosocial support to others. They receive comprehensive training as support companions, and then they're matched with the patient. By building a relationship with their patients, the volunteers improve quality of life, relieve social isolation, and also become part of a person's support network. The service is non-medical and non-task-based, and a volunteer will visit for a minimum of 2 hours each week. Some volunteers help by taking people to appointments or shopping, and some just spend time listening and chatting. We accept referrals from all over Auckland for people with life-limiting and terminal conditions. Anyone can refer a person to Amitāba, including family members, through our online referral form. We also have 2 social groups that meet at Amitāba on Tuesday mornings for social support and interest sharing, called Kappa and Company, and another on Friday mornings where volunteer artist facilitates creative activities, and all volunteers and their patients are welcome. Thank you.
Kia ora, Claire, that's great. Thank you very much. So we'll now move on to, and as I said, if you want to put your contact in the sidebar or any questions, that's great. So Anxiety New Zealand, we've got Sarah. Hi, Sarah. And if you can lower your...
Kia ora koutou. Morning, everyone. I'm from Anxiety New Zealand Trust. We were formerly known as the Phobic Trust and were established in 1980. We've got a physical location in St. Luke's, Auckland, and we're a national presence with a number of our services. So we offer a free 24-hour national helpline, and anybody can call it, whaiora, whānau, even kaimahi, if you want to have a chat about anxiety, learn a lot of psychoeducation, some brief intervention, breathing, relaxation exercises, distraction techniques we will do over the phone with you. And we also have a clinic in St. Luke's, Auckland, where we have 10 psychologists, psychotherapists and a doctor, and they can offer psychological assessment, psychiatric assessment, and therapeutic process supported for people in all ages. So anybody can refer to us. We've got our referral forms on our website. We see people of all ages, low to moderate risk, who are experiencing anxiety related issues. They don't need to have a diagnosis, and there's no catchment area. There isn't any restriction on number of sessions. Now, the clinical services aren't automatically funded. So what that means is we do support people to get a disability allowance for counselling costs if they're eligible. Some people might be able to use insurance, or if they're international students, travel insurance. We do occasionally get a small amount of funding that we can assign to support people for therapy. The other thing is we have free peer support groups with a Te Whatu Order contract, a long-standing one from the Waitakere Auckland DHB region. And so that's anybody 18 plus who's eligible for health services in New Zealand. You can refer to the peer support group service, and we have 5 peer groups that run in person in St. Luke's or Takapuna.
Oh, you've gone muted. Oh, you've been muted. Great. All right. Thank you. Thank you, Sarah. That's great. Now we're going to move on to Asthma New Zealand. Do we have Katie here? Haven't seen her. So we'll move on to Disability Connect with Denise. Welcome, Denise.
Hi, it's great to be back again. And I love hearing stuff about going on with Waitakere Hospital, because I live a 5-minute walk from there, and I just like to see it growing and getting bigger to serve so many people. I'm here to talk about our Transition Expo, which is quite a big thing for our organisation. We support people with disabilities from birth all the way through to the ageing process. But our Transition Expo is for young people from 14 to 25, beginning the process and going through the process of leaving school. And on September the 6th, we have the Transition Expo at the netball courts. I'll put the link in the chat. And we have vocational providers, we have transition providers, we've got employers coming. And this gives an opportunity for families and the young person with disability to choose what providers they want to support them, to give them an opportunity to dream what their future can look like. So that's what we want to share with you.
Thank you so much. Short and sweet, but nonetheless very informative. Thank you. And I just took all your comments about Waitakere Hospital. So now we have Catherine from Epilepsy New Zealand. We'll just get you to unmute.
Is that working? Oh, that's working now.
Yes,
I thought when I put my
is.
mouthpiece down, it usually unmutes, but kia ora everyone, I'm Catherine from Epilepsy New Zealand. I cover the Waitākere region, but Epilepsy New Zealand, by way of its name, covers all of New Zealand. We've got educators dotted around the country who provide education and support directly to families who have a person with epilepsy from birth to from woe to go. We also provide a lot of training, particularly to schools and workplaces, help people get back into the workplace if they have a diagnosis of epilepsy. And we raise awareness in the community as much as we can. There's two things I'd like to mention. First of all, we've got a survey running at the moment on the social impact of living with epilepsy. It's the biggest survey that's been done in many years, and it's been done by an external company. It's a great survey asking people to comment on how living with epilepsy impacts on their life, and we're hoping that will go some way to shaping our services in the future. So if anyone's interested in that, I can send a link. It actually only runs till the end of the month, so we've only got a few days left to give it a final push. It's been running for a couple of months. And the other thing I'd just like to mention is we've got a program called Seizure Smart. Some of you may be aware of Seizure Smart Schools. That's been around a while, on an online training opportunity for schools. We're currently running a pilot on Seizure Smart Workplaces, where if a workplace has somebody with epilepsy, they can go online and do training at the moment for free, but there will be a cost coming online in a few months' time. So,
oh, you've been muted. Sorry, Catherine, but if you want to put the link to the survey in the chat, that would be really great, because I'm sure, epilepsy affects people right across the spectrum of the demographic, and so there may be someone who knows somebody. Thank you very much. All right, so we've got Trish Fleming from Hospice West Auckland. Welcome, Trish.
Kia ora tātou, called Trish Fleming, tōku ingoa. Hospice is often viewed as somewhere nobody wants to go and as being the very last resort, but we're on a kaupapa to say caring for people who have a non-curative illness is anything from 12 to 18 months out. We provide free 24/7 support to anybody aged over 18 with any illness, and often people think that hospices just care for people with cancer, so please, not so. And it is a 24/7 service designed to help people to be where they want to be, which is mostly in their domestic environment. And so we care for people from the kaipara down to the phone. We provide 24/7 service. Last evening we hosted a very beautiful midwinter remembrance event at King's Plant Barn to honour and remember those we've cared for in the last 6 months since the Christmas period. And for Matariki last week, we dug and turned the soil on the beginnings of a rongoa garden at Hospice West Auckland. So we have a rongoa practitioner. We really do offer a te whare tapawha service. Look out for the information about the development of our rongoa garden over the next 12 months. You all have an opportunity to find out about it, be involved in it, have your organisation participate in working bees, etc., as we develop this resource for West Auckland. Thank you.
Oh, kia ora, Trish. Great news. So we next have Richard from Independent Living Charitable Trust. Welcome, Richard.
Hi, and just a quick hi to Tom, Denise and Miriama. So, Independent Living, we provide information and advice on a range of solutions for people with disabilities to live a good life. The second thing we do is we provide access to assistive technology and aids for daily living. Assistive technology is a marketing term meaning the stuff that we flog. everything from things to help you open a can, to beds, to lift chairs, to scooters. And the last thing we do is we collaborate with other organizations to improve equity and access for disabled people. We have 3 stores, Royal Oak, Botany, and Browns Bay. Not much use to any of us out west, but we have a mobile service which I run, which comes out and gives presentations to people to tell them about the assistive technology and let them have a play and a look before they decide if it's what they want. And thank you for having me on this call today, so I'm not out in this howling rain and hail. Thank you.
Thank you, Richard. And I must say, we used to have this in the hospitals, but because of Zoom, because of COVID, one of the positive unintended consequences is now we do it on Zoom, and it just makes it so much easier for everybody. And we get a lot more people participating. So thank you, Richard. Right, so we next have Penelope from MS Auckland. Welcome, Penelope.
Thank you. Marina, my name is Penelope Butler. I'm a community advisor for MS Auckland, and I work with MS members in West Auckland and the Rodney areas. As a community advisor, I provide community-based support to people living with multiple sclerosis and their support people. As a team, we cover the whole Auckland region, and being community-based, we're available to meet with members in their home, their workplace, public space, or on the phone or Zoom to best suit our members. We provide support, information, advice, connection, and a lot of referrals. We also have several support groups operating throughout Auckland. In West Auckland, we currently have Henderson and Kumu support groups, and I'm also involved in the Silverdale one too. There's an online Zoom support group for all of Auckland, so great for days like this to get lots of attendance, and support for newly diagnosed, support groups for them too. MS Auckland has developed formal one-on-one peer support programs with trained volunteers who are available to talk to our members. And we provide members with monthly newsletters, a magazine called Multiple News. The website has some fabulous webinars, and we also have recorded exercise sessions ready for people to use, as well as information on exercise groups in Auckland. So in general, MS Auckland covers many services to help people with MS to live well. And most importantly, it is free for members to join MS Auckland, and it is easy to sign up online. And thanks for having me. I'm quite new to the group, so nice to meet you all and to hear all about you too.
Thank you. And you did a fabulous job, Penelope. Thank you very much. So next we have Lynn from Muscular Dystrophy Northern. Welcome, Lynn.
Thank you. Good morning, everyone. So I'm Lynn from Muscular Dystrophy, and my area is I am a field worker, and I work between Panmure and way up north. Excuse me, I got a bit of a tickle. I look after people with all forms of muscular dystrophy, everyone from a child born with SMA right to a person who has myotonic dystrophy, right through the whole spectrum. And we do that by supporting them, giving them information. We work closely with the Neuromuscular Registry so that they have access to overseas studies, information, and anything that might involve giving them more awareness around their condition. We support them by way of having, we have social groups, we have Facebook pages, and currently we're going to be in September running our Roll 1K annual appeal. So that's to get people who are in wheelchairs to promote the service that we provide to everybody, and just to be involved in the community and raise awareness around muscular dystrophy. Thank you.
Thank you, Lynn. Now we have Tom Hoy from Neuro Connection. I see you there, Tom. You still there?
So Tom Hoy, Neuro Connection Foundation. We're a charitable foundation based in Tui Glen. So we provide rehab and other support for neurologically impaired people, mostly with Parkinson's, stroke, multiple sclerosis. So we use conductive education as the means of delivering that service, and we've now started to look further afield in how we can support our clients and other community members who are suffering from neurological ailments. We have now got what we call NeuroChat, and shout out to Trish. Her team have come along and presented at our NeuroChat for us, which is every few months we put together a 2-hour session for everyone to come along, and we invite people from the community and other community groups to come in and tell people what is available and what they can do and how other support groups can help them. So that's been really successful. We also run now a coffee group every second week where we bring all the clients and non-clients can come in and spend 2 hours in the building having coffee and meeting each other. We're finding that most of our neurologically impaired people and clients, they seem to help each other more than in some ways we help them sometimes. So having the ability to talk. I've also been focusing on a couple of things. So Richard and team, we met at the Whakaha sponsored or funded Better Lives Matter cohort that's been going on all around the country for the last wee while. So that's a 20-week course that we've all been on for the last, obviously 20 weeks. We just finished yesterday. And that's been really enlightening about us, everybody in this sector using the same language and actually talking about, disablement and so on in the same voice.
Oh, sorry, Tom, you've been muted, but I think you got a really clear message on there and got on your group for getting further education. So thank you, Tom, and we're going to move now to Monica from the Stroke Foundation. Welcome, Monica.
Good morning. Hi, I'm Monica, as she said, from the Stroke Foundation. I am team leader and community stroke advisor for the northern region. The area that I cover is Albany over to Waitākere, and then at some of the other previous of these meetings, you've met my other colleague, Pauline, who covers the rest of West Auckland. I will say just in general, Stroke Foundation, we have now merged with the central region. So now we officially cover all of New Zealand, which is very exciting for anyone in the country to get the same sort of service afterwards. So yes, our main service is our community stroke advisory service, helping people after they've had a stroke and their whānau in information, advice and support. Sometimes that's connecting up with other services like yourselves in any way that, again, best helps the client. We can also receive referrals at any point in someone's stroke journey. Typically, we do get them directly from the hospital to kind of get in there right away in the initial early stages, but have had people touch base with us and come back years later down the road just to get a bit more information or some support. We also do have a prevention space with our blood pressure van, and so that goes out to the community. We have started doing more workplaces as well, offering free blood pressure checks. So if there is any other like large community events where there's a few of us community services getting together, is always good to know. And then if the blood pressure van is able to attend as well.
Right. Yep, I know it's a bit disconcerting suddenly not hearing yourself, isn't it? So sorry about that. Part of me feels it's really rude, but it's just a necessity to keep it going. So thank you so much. That's fantastic. Now the next person was Wilson Home, but I don't see Felicity here. And we know Wilson Home offers services for physically disabled children. Now, and we also have an apology from Jackie from Your Way Kia Roha. So now we move on to mental health social services. So if all of you can put your virtual hands up. So Dayspring, Grief Centre, Hearts and Minds, Jade Speaks Up, Kahui Te Kaha, Lifewise, looks like 2 Lifewise, I'm not sure, Man Alive, Problem Gambling, Real World Living. So have we got Sheena from Dayspring? Yes, we have. So the floor is yours, Sheena. Welcome.
Welcome. I hope everybody can hear me. I forgot my headset.
No, we're good. We can hear you very well.
Oh, good. So yes, we're a charitable service, and our physical location is in Newland, but we have a range of services. We sort of got integrated range of wraparound maternal mental health care services for mothers that have either pregnancy, post-pregnancy, postpartum depression or trauma and anxiety, as well as actually mothers that have got mental health conditions. So we deal with both. As services that cover that are three main areas. So we have counselling, and this is not limited to a maximum number of sessions. It's not funded by a contract, so we're not restricted by area either. And so we have two counsellors. And at the moment, I think it's closed. Unfortunately, there is a huge need for counselling in this space. We also have a maternal mental health community health workers. So that is restricted by area, and that we get most of our referrals coming through from the maternal mental health team or infant mental health team. And that is a home-based outreach type service. So we have a team of about 4 work in that area. So that covers West Auckland and the North. We have an early attachment-based therapy program too, and contracted for that called Secure Beginning. So that's a 20-week program for a mother or a caregiver and their child. So
well, I think you've done, Sheena, sorry. You're 1:30, but I think it's about getting practiced, about delivering it quickly, isn't it? I mean, you've got so much information, but thank you so much. I know your organisation do a lot of work in that maternal mental health space. Right, we next have Katrina from the Grief Centre. Welcome, Katrina.
Thank you. Kia ora, everyone. I'm Katrina. I'm the General Manager at the Grief Centre. We're a charitable trust founded in 2014, and we provide loss and grief support to children, youth, adults and whānau experiencing any form of significant loss. So this is people grieving around bereavement, relationship loss, redundancy, illness and loss of faculty, perinatal loss, infertility, disability, even migration, pet loss. And we also provide a training and professional development program and supervision staff support sessions for professionals, community workers and other relevant organisations in our community. Our kaupapa is to assist anyone regardless of financial circumstance to live through their loss. So we provide counselling, support groups, we have an ACC sensitive claims contract, we have resources, we do after funeral care provided through funeral homes, professional training and workshops, and obviously that supervision and staff support. We are North Shore based, but we have a team of 27 grief counsellors nationwide. We do have quite a few counsellors out west, and they can provide counselling face-to-face, online or on the phone. And anyone can refer to us, from doctors, health professionals, EAP organisations, self-referral. So we have support groups as well that we try and operate either face-to-face or online. So if you want more information, griefcentre.org.nz, and I'll put that in the chat. So thanks very much for having me.
Thank you. I just had to mute. We've just got a major thunderstorm going on here, so I hope you can still hear me. So we've got now Hearts and Minds, Gabby.
Hi there. Can everyone hear me? Yep, lovely. Yeah, so I'm from Hearts and Minds. If you haven't heard of us before, we offer free wellbeing and resilience courses to anyone living within the Waitākere area. That referrals can come from any healthcare professional, community organisation, and we also accept self-referrals now, although if you can refer your clients, that's ideal for us. So courses are educational, aimed at people with mild to moderate mental health needs, covering topics such as managing stress, anxiety, depression. So if you want more information about the courses, feel free to get in contact. We also have our support services directory, which if you feature in it, you are entitled to a free copy. So do get in contact if you want your free copy and you haven't got it already. And if you want to feature in it, get in contact and we can make sure you're in it. So that's probably a really quick summary, but happy for a chat if anyone wants to find out more about what we offer.
Thank you, Gabby. Great work. So next we have Jade Speaks Up. Elaine, are you there? I saw you.
Yes, kia ora. Hello,
Kia ora.
old friends and new friends, and what a rich sharing for the community that this is to hear all of these different things. Jade Speaks Up grew out of the Violence-Free Waitākere initiative that really grew in our area. It's a schools program supporting children who are 8 to 10 years old, 8 to 12 years old, sorry, in being able to respond effectively if they're in situations of family harm, which we know is a major issue in our community. When the police are making 500 call-outs a day nationally to the probably 10% of families that reach out for help around family harm. We also have developed a whole new program called You Good, You Good, which is looking at anxiety and stress for the same age group. We train teachers of that age group and we give them support to be able to deliver that program to their classes. And I'll put our connection on the chat in a moment. And we've got some trainings coming up over the next month. So if anyone's interested in being part of it, for particularly social workers in schools or other people that are associated with schools, it would be really great to have you join us. Yeah, thank you for the chance to see there, and a big smile to everyone that I know that I can see your faces. It's lovely.
Lovely to see you, Elaine. Kia ora. Right, so next we have Sulia from Kahui Te Kaha, but I can't see them here. Is anyone from Kahui Te Kaha? Nope, we're going to move on. So LifeWise, Lee Comport.
Hi there, everybody. So I'm Lee Comport. I'm one of the community social workers from LifeWise Community Social Services. There are 2 of us working in the community. We also run toolbox parenting courses, and so we have a number of facilitators. We have the parenting through separation contract with the family courts, and so we can offer support to the community for that. And we also have a large team of whānau workers working with families to return children home who have been in the care of oranga tamariki, and or they run the risk of having their children taken into care of oranga tamariki. So we have a large team that work with oranga tamariki to address that. So that's our team, and we have four supervisors. So yeah, families can self-refer to us, and we're happy to work with them to achieve their goals that they identify themselves. So that's us, and we will also accept referrals from other community groups as and when needed. That's us.
Thank you very much, Lee. Great work. Right, next we have Jose from Man. I
Hello,
can see him
hear me?
there. Oh,
Can you hear me?
Yes. Yes.
Okay.
Great.
Thank you very much for having me. So nice to meet you, everyone. My name is Jose, and I'm the manager of the youth department at Mana Life. So we provide counseling sessions in West Auckland, Panmure, Orewa, and as well Whangarei. So our main groups here are Boys Alive, that is the anger management program for kids from 8 to 12 years old. We have sessions every term of the year, so we have 4 groups per year. So we just started last week, one of them, and we have sessions every Wednesday from 4 to 6:30, and we include the parents the last 15 minutes of the session. So they learn strategies, how to control the anger and how to be better relating with others. As well, we have another program that is called Boys Alive in Schools. That is, we help kids to move from intermediate to high school. We have 5 sessions when they are in intermediate and 3 sessions when they are in high school to see how the transition was. As well, we have individual counseling sessions for different issues like anxiety, depression, sexual abuse, being bullied, and all the different kind of things that you can imagine. So if you want more details, I will leave all the contact numbers there in the chat. So thank you for having me and have a good day.
Oh, thank you, Jose. Great update. Now, we had Nita from Problem Gambling, but I can't see them on the list. But if there's anyone from Problem Gambling, jump in. 3-second roll. 1, 2, 3. No. And the next is Marion from Real World Living, and I didn't see them either. Is Marion here? 1, 2, 3. All right, we'll go on to community health now. So if the community health people can pop their hands up, that's Aotearoa Africa Foundation, Asian Family Services, St. John, Hatuhone, Tamaki Health, White Cross Local Doctors, Asian Network, Tani, Vision West Home Healthcare. I think that's it. So we'll start off with Redland there from Aotearoa Africa Foundation. Kia ora, Red.
Kia ora, everyone. Kia ora koutou. My name is Red, and I'm the chair of the Aotearoa Africa Foundation. We are a charitable trust, and we specialize in advocacy. Also, we're looking at the health issue within the African communities. So we have members of our communities who deal with mental health, and also we're doing research into African reproductive health. And we want to understand that the issues like reproductive health and the taboos also within the African communities when it comes to cultural aspect of it, and also reproductive health. So, and we're also looking at expanding into African health services because it's really important for people in our community. So this is a perfect platform also for us to connect. And also we can be referring people as well for the services that we don't have. So I'm looking forward to it. And I'll leave my email also on there so we can connect as well. And yes, pleasure to be and continue to contribute as well with the link here. Thank you.
All right, thank you. And Red, are you still in the little train station on Roadside Ave? Or is that different?
It's different.
Okay, it's different. That's all right. Was just not sure. Thank you. That's great. Thank you. All right. So next we have, it looks like we've got Darcy here. Darcy Zhao from Tani. Are you the one speaking, Darcy?
Yes, hi everyone. My name is Darcy. I'm come from Asian Family Services. So it's my 30-second start. Okay, so
yes. Sorry,
okay.
Not Tani. My mistake. Go.
Yeah, okay.
It's 1 minute 30. You get more than 30 seconds.
Okay, yeah. So Asian Family Services, we are a provider for Asian people who are affected by gambling harm, mental health issues. And also we have public health education, and we do community support and navigation. And my role is helpline and the community connected coordinator. And we take the referrals from GP, clinical, school, police, and the community. Our helpline, we have different language. We have English, Mandarin, Cantonese, Korea, Vietnamese, Japanese, Thai, and Hindi. And also we do presentation workshops. So far, we have a presentation on 6th of August. We're working with fire emergency, neighborhood support, and also Nostro Police Station. So if you have the referrals as clients coming from Asian community, you can make a referral to me. And also we have Auckland branch, Wellington, and Christchurch office, the branch. And also, I still have time, but I don't know what to say as what a bad weather last night. I hope everyone is good. Yeah.
Thank you so much, Darcy. It's great. You don't, and everybody, you don't have to fill up the whole time. It's not a target, but it's great. Thank you. Right, so next we have St. John, New Zealand, and looks like we've got Sally here. Hi, Sally.
Hi, everybody. My name's Sally Johnson, and I'm the Healthcare Relationship Manager for St. John in their Medical Alarm Division. So St. John is a very large organisation, as everybody knows. So my role really is to provide information, education and support for health professionals in terms of our medical alarms. So giving presentations and talks to them and helping them with resources. We also touch on, we have other language brochures, brochures, and we can provide PDFs and certificates of attendance for those health professionals. So I do that from the top of the North Island and half of Auckland, and that's in DHBs, hospitals, one-on-ones with educators in the NGO sector and medical practices. So I'll put my details in there. If you haven't seen me before, hit me up, let me know. We'll come and talk to your group and give them some information and support about how to refer your patients and give them support in the community via St John. Thank you.
Wonderful. Thank you, Sally. Now, I see next Tamaki Health White Cross, but I don't see anybody on the list. But if anybody is, can they just give me a shout?
Hi there, my name is Sabiha. I'm from Tamaki Health.
Great, thank you.
Yeah, no worries. So kia ora, thank you for the space. So I'm from Tamaki Health and I work for the wellness support team. So my team provides services all across Auckland, but a lot in West Auckland as well, such as Henderson, Ranui and Ratanui. We provide individual and group services. So we do one-on-one counselling, couples counselling and family counselling as well for all ages. We also provide psychiatry support. So that's medication review, treatments, and also assessments. And these sessions, including the counselling, are funded by the clinics, so the local doctors' clinics. So these are fully free for registered patients. And we also do group sessions as well. So we do our mindfulness and meditation courses, our self-management education health courses, and also our men's group courses. And these are held in mostly community venues. So there's actually a course going out in Hub West Henderson at the moment. So yeah, that's just a brief overview for our team. I'll drop my email address in the comments. If you guys have any further questions, you can just hit me up.
Thank you, Sabiha. And that was just to clarify, that's the Tamaki Health Wellbeing team.
Yes, that's right.
But you've got Ratanui, Ranui and Henderson clinics.
Yes, yeah.
Great, thank you. Now, next we have the Asian Network, Samuel Cho. Welcome, Samuel. Can't see you there, Samuel.
Thank you, Linda.
Oh, yeah, here we go.
Can you hear me properly?
Yes,
right.
We're good.
Yeah. Kia ora, good morning. 안녕하세요. And it's quite nasty weather. The thunderstorms and heavy rains around me, and probably it doesn't quite disrupt my speaking to you. I'm the Samuel Jones, looking at the Asian network, TANI. That stands for the Asian Network Incorporated. I'm looking after the hours of operation on the part of a service provided to the Auckland wide and then also Hamilton's. We are committed to promoting the health and well-being of Asian and migrant communities by raising health and safety awareness and providing information education. Also, we support those affected by the flood and the severe weather event that was happened in the Auckland region by providing food and information. However, still we no longer are available the support service for those with affected by COVID. At the Ministry of Social Development closed the food service. And also we provide programs like the 5 weeks of the migrant women well-being programs that include the free driving lessons, and also provide health seminars and health events for the community, where we're working close with the mainstream service providers like screening programs, and we invite those Asian community to enroll to those kind of screening, national screening program as well. We provide the regional network meetings where we update information and foster connection, and then looking after the collaboration opportunity as well. We also publish newsletter in 3 different languages of the Chinese, Korean, and English, of course, to promote health message and information, where you can provide your if you have any kind of message and lovely stories that you sharing about how your service and program works well. We are welcome to use our space, which is free. So yeah, basically, feel free to talk to me if you are interested in working with those population groups, and then collaboration with us. I'm always happy to talk and discuss with you.
Thank you, Samuel. I think you just sneaked in the time limit there. Thank you. All right, so now we have Fatima from Vision West Home Healthcare. Welcome, Fatima. Can't hear you, so maybe, let me see.
I'll ask her to unmute.
Oh, unmute.
Kia ora, morena, everyone. My name is Fatima Husson. I'm the Regional Service Manager for Vision West Home Healthcare. Vision West is a home and community support service provider in the Waitākere district. We cover all of West Auckland, North Shore, Hibiscus area, and part of the Rodney district. We have as well, we provide as well services in other regions, like in the Bay of Plenty, lakes in the Waikato district. So we provide support services to elderly people with young people with physical and mental disabilities, with personal cares in home management and some respite, in-home respite care. We're contracted with the Waitākere district and the Ministry of Health, and we do provide private funded support to the people. Let's see. Thank you. Thanks, Linda.
Thank you so much, Fatima. So that's the end of the presentations, but I just want to give an opportunity. Is there anybody that came on expecting to speak and I didn't call your name out? Just pipe up. Don't think so. All right, thank you. So now we're on to general updates. As we said, we've had our Waitakere Hospital update and the locality planning. We were going to have Work Plan Program Director for Tamaki Iwi Māori Partnership Board, Lance Norman, but he said to us there is no update at the moment. At the moment, they still haven't decided what the boundaries are for the Auckland locality. So until they do that, it's difficult to go ahead. So it is a bit disappointing that they haven't got any further, but I think our area is in their hands until they decide what that locality is. We did have a verbal update from Lance at our, I think 2 meetings ago at our HealthLink meeting, but basically saying the same thing. I think it's a bit slow going, unfortunately, but I'm sure we'll get there because we're well deserving of having our own locality and to have a focus on the West. Community support brochure, Erica, who has been working on that, Erica Fairbank, Patient Experience Waitākere. And here it is. I don't know if you can see it. It's a lovely brochure. So it has been printed now. We did have a bit of an update, I think, last time about that. If you have any questions about that, what did we want to do?
Her name in.
I'm going to put her name and email in there. I think it's online as well, isn't it?
On our website.
It's on our website anyway in electronic form. So you can see whether you're in it, but I think it's been very well consulted and it's a great document. And we know that not everybody wants paper now, not everybody wants electronic. So there's both available. It says I cannot see you at all, Linda. Oh, okay. So maybe we, why is the view? Should be speaker view. I've got that, but it's not happening. So, okay, so here's the booklet. Oh, I see. It's because, here we go. Put it up there. So anyway, it's there. It's done, which is great.
Doesn't look like a face, so it's not. There we are. Can you sort of see it now?
Yeah, I think with my background, it was merging into my background. Sorry about that. Anyway, we've got that contact for Erica at Waitākere DHB. They still say DHB, even though it's Te Whatu Ora. So, okay, so that's that. Now, have we got Tim here from the Well Foundation?
Yep.
Tim, welcome.
Thanks, Linda. Tracy, are you able to let me share screen so I can share some pictures? Is that?
You should be able to share screen. Does
Okay.
it say no?
No. Let me just. It does say that it's disabled. Yeah. There we go. That's fixed it. Thank you. Okay. Is that coming through for everyone? Great. So, kia ora everyone. I'm Tim. I head up Well Foundation, and many of you will know that we are the official charity partner for the Waitākere district for health services and for the Waitakere Hospital and for North Shore Hospital. So we've done a lot of work with the West Auckland community and with Waitakere Hospital over the years. And at the moment, one of our current priorities serves the West Auckland community, but is based at North Shore Hospital. So I wanted to just acknowledge that, it was great to hear the update from Paula around the things that are happening on campus, and that's all exciting. But there's also things happening on the North Shore Hospital campus that are relevant to us as a community out west. And I get that's a little bit bittersweet, because we'd love to have all of these things on our back doorstep as part of Waitakere Hospital. But the reality is that this is a regional facility that I'm going to talk about, and it's something that will serve us and will benefit from us. So just wanted to acknowledge that there's a little bit of hoha there as I do this. So this is called Tautara Haumuru. It's on the North Shore Hospital site. So if you, many of you will be familiar with the North Shore Hospital site. This is Smells Farm down the bottom left-hand corner there. These are the old maternity buildings, red brick buildings that got knocked over. So over the last 18 months, 2 years, there's been a lot of development on that site to build this new hospital facility. And if I go to that one there. So at a top level, the facility provides 150 new beds for the region, 8 new operating theatres, 4 new endoscopy suites. It's 20,000 square metres. You've got these 3 floors up and 1 floor underneath, which is where the surgical spaces are. So this is actually going to be in the same way currently, where if you need surgical services or some specialist medical care, even though you are a West Auckland resident, you might be referred into North Shore Hospital for your care. And actually, under the Te Whatu order model, this will be the first facility that is genuinely regional across, including Northland down to counties Manukau, where actually surgeons from those regions will come up and bring their patients, and it will be genuinely a non-postcode opportunity for care within this facility. And so the reason I'm sort of giving you this update, I've done it maybe a year ago, is that it's due to open in May. Actually in April next year. They brought that forward. It's the first capital project I've ever been involved with that has been brought forward with its opening. So it's to time and to budget. And I just want to talk a little bit about the projects that we're involved with, because in the middle of this hospital facility, you can see here, see that glass bit at the front there? This is this beautiful glass roofed and glass fronted and glass backed atrium area. And as you can see there, if I'm honest, that looks a little bit like a prison. And so we saw this space and we thought, actually, there's opportunities here to do more for the community, for it to, the full potential of the space to be realised. It will set the atmosphere for the hospital. And so we, as a foundation, have said, look, as part of your $320 million for the hospital, we know you can't afford to put a beautiful green space in there, but let us champion that. And so we're helping turn it into this, a green space that can be used by all visitors, by all patients, by staff at the back in that fenced off area there for staff. So it is going to be pretty amazing for this hospital facility to have that. It's the first time in New Zealand that we'll have this sort of green space, and there's a lot of well-being, evidence-based benefits for having a green space in the hospital. This is, I don't know if this is going to work. Is that coming through the video? There you go. So Jazz Max, the architect. So you walk into this main reception area, coffee booth, and instead of it just being tables and chairs chucked out there, they don't do the rendering of these plants very well. It will be a lot more lush than that. This beautiful sculpted lighting that's suspended from the ceiling. The wards look down on it from the left and right there, so they're actually care spaces, elevated areas on the first floor that look down into it. So it is going to really define the whole mood of the hospital, which is quite cool. And so the cost of getting to this point where it's all in place and constructed and installed is about $2 million. So that's what we're working towards, and we've raised over half of that already and need to do the rest of it by the end of May. So you'll see us out there fundraising for that. Very quickly, just wanted to touch on the 2 other projects. I've mentioned these before. Within the hospital, there are these 5, what we're calling whānau rooms. On the right-hand side, there are clinical care space, and these are care spaces that are for either end-of-life care or for critical care. And what we've really lacked in our hospital environments is the ability for whānau, for families to be together and provide care, be part of that care team in those really difficult times. We're good at letting people come in during visiting hours, but actually being able to be there 24/7. And so this space was always going to be there, but we said, let's make it amazing for families. And we've raised $250,000 to fit them out to another level that makes it feel not as much like a clinical hospital space. So here's an example here of the kitchen fit out, that sort of communal family space where people can come together and be very close to their loved one. I've had some other images there, but it can actually convert into whare style overnight. And then the last project, this is the Da Vinci surgical robot. To the left there, the surgeon works in a console. They peer into that screen there while the patient is off to the right. It all seems quite robotic and AI-like, but it's entirely safe. And it achieves minimally invasive surgical outcomes. You get benefits, faster recovery, quicker discharge. Complications are less in some procedures. But this project, to actually have this robot, costs about $5 million, but then there's another $5 million of operating costs and maintenance over 10 years. And so we have really championed having this surgical robot available for the community, because at the moment there's only 5 of them available in New Zealand, and they are all within private. And so there's been this sort of barrier and challenge for how we bring this to public. And we raised about $750,000 to help unlock that. And just recently there's been a decision for this new hospital service that I talked about before, Totara Homeru and North Shore Hospital, to have ongoing use of this robot, which they previously had loaned. So actually our community will benefit from this robotic surgical care, this innovation, and it'll be here for the next decade, and we're the first region to have that. But it will be regionalised beyond just Waitākere. And that's the interim model that we had at North Shore Hospital. So I'll leave it at that. I've taken a lot more than 1 minute 30, so I appreciate you giving me that space to update. But as you can see, it's an exciting development for our care across the region.
Thank you, Tim. We wouldn't cut you off because it's really important information anyway. So I don't think you're limited to the 1 minute 30. But thank you for all the work you do. And I mean, I know the kind of efforts that have to go into fundraising over and above government funding. And you partnered with us for our special care baby unit as well over here, which is really fantastic. So amongst many other things. So that's good. It's almost looking like a private hospital, which is pretty awesome for us. You know, people in the Waitākere to access. So thank you for that. It's great. All the best and the continued fundraising. So just going to follow up on the primary birthing unit, and I think we're going to have Ben share a little bit of the primary birthing unit document on screen. This was something, the primary birthing unit, we started in 2015, the Waitākere DHB, consulting with our community. And what the outcome of that was that our women in our community said, we want something less medicalised. We want something that's less formal, but we can safely deliver our babies, maybe if not at home, but they're interim, not in the hospital, but on the grounds of the hospital, where if anything happened, they could get quick help, but that it just was much more relaxed. And particularly our Māori Pacific community said they wanted that. And so it's a little bit disconcerting that all the work's been done. And now the Te Whatu Ora Capital Investment Committee have said, go off you go. We now need to send it off to the 2 ministers of health and finance. So it seems we always seem to get these roadblocks for the West. I see South Auckland birthing units just been opened. And we know there's a lot of, I mean, people have heard me say this before, we know there's a lot of need in the South, but we have a lot of need in our community. The need is already demonstrated. We know that need is there already. So it's not new, and I don't think we can wait any longer. And the information I had is that there's already, the information I had is that the delay is extremely unfortunate. As going forward, we've predicted an increased demand for maternity beds and are already experiencing occasions of high demand with every bed full. We're planning to have the primary birthing unit available. We were planning to have that ready to accommodate these families. Shortage of maternity beds causes delays and urgent inter-hospital transfers and increases the stress on whānau and ainga when they cannot be certain there is somewhere safe for them to give birth. Without these beds, it is likely that women will have to give birth further from home. So what our board are going to do, we're going to write to we're going to write to the Minister of Finance, we're going to write to the Minister of Health, who will be seeing this, and we will copy into all our West Auckland MPs, because we want to urge the Minister of Health and the Minister of Finance to not delay this, because we're told that is an option, to yet again delay it, which would be a tragedy for our women giving birth. And so we want to urge them to approve this now. It's $12 million, and in the big scheme of things, that's not a lot for a really fantastic outcome. And you can see the plan there. It's all been consulted. It's been through, consumers who think it's fantastic. We've got the land here on the Waitākere hospital site. We just need the go ahead and the money. So as Waitākere Health Link board, we're going to write to those ministers and copy into MPs. We urge you all to do the same. We'll put a copy. What we're going to try and do is set up a link on our website. If not, we're going to send you the letter that we've sent and all the email addresses, and we really urge all of you to do that on behalf of our community, because Waitākere Health Link is the voice of Waitakere community, but with the backing of all the NGOs as well, and anybody that you think might just let our voice be heard, because we often are second in need to South Auckland. And as I say again, it's not negating the need in South Auckland, but we have high need as well. And it's a demonstrated urgent need right now. So, and you can see it's fantastic. So we need that as soon as possible. So that's my little rant. We'll do that. So now I'm going to talk about our AGM. So our AGM's coming up again. And, last year, a lot of you attended and we farewelled our DHB members, and we've had Te Whatu Ora for a year. We've had fantastic communications with our on-site staff at Waitakere. They've been extraordinary, and they've been dealing with all the changes as well and uncertainties. But we're going to have Mark Shepherd, the Regional Director of Hospital and Specialist Services Northern Region, Te Whatu Ora, come to speak to us again, updating on hospital and specialist services. And you remember we had Dale Bramley last year. It will be on Monday, the 4th of September, 1 to 3 at our Te Pai netball courts. And there'll be a few refreshments as well, if that helps to get people along. So we'd love to see you there. We'll also have the NGO opportunity again, like we always do, for you to do your quick elevator pitch. Was there anything else I needed to add? We'd love you to come along, but that's we'll have that up on our website as well. We'd love you to come along and hear the guest speaker. Mark Shepherd was here at Waitakere. He's been really great, also communicating along with Paula Seymour. So I think that's it, isn't it? I'm speaking to my trusty Tracy over here. Yep. That's all. I want to thank you all for participating. You're all awesome. Thank you for all the fantastic work you do for our Westies and beyond. We really appreciate it, as fellow Westies, what you do for our people. And I'll just do my little closing. And it is kia whakaaerea te tapu, kia wātia ai te ara, kia tūruki whakataha ai, kia tūruki whakataha ai, haumie, huie, tāhiki. And what that says is restrictions are moved aside so the pathway is clear to return to our everyday activities. Kia ora tātou, everybody.
Thank you.
Mā te wā.